Hospitals say they are seeing a dramatic decrease in people coming in for hospital care out of fear of contracting COVID-19.
What we are seeing as I would say, as a detriment is that people are afraid to come to the ER to check for the things that they should, like heart attacks and strokes and other infections.
Dr. Reynoso, the chief medical officer of Adventist Health Bakersfield and Tehachapi, says people shouldn't be afraid to visit their hospitals. CDC and Kern County public health guidelines are being followed. Staff are being screened for COVID-19 symptoms, and visitors are not allowed. Plus, there's a separate floor and emergency room areas for patients who may have COVID-19. Reynoso warns delaying care could possibly decrease patient recovery and increase risk and mortality.
We are really worried about, the heart attacks and the stroke, because we understand that if you don't intervene on time, then the damage and the consequence are higher.
Chief Medical Officer Russell Judd of Kern Medical says their emergency rooms are also seeing a decrease in patients, which he says is a concern.
I think across our community, we as healthcare providers are concerned. People are putting themselves at risk out of fear of catching COVID.
Judd says during the initial outbreak, there was an immense amount of information from a county and state level to not go to doctors' offices and hospitals. But since then, he says patients need to know that policies and protection measures have been put in place, and patients should feel safe when seeking medical attention, and they shouldn't stay home and self-diagnose.
Do not delay care out of fear of getting COVID. The chance of you getting COVID at a hospital is very small because we are protecting you. We have systems in place to keep you safe. We have different entrances. We immediately screen anybody who's potentially positive. You have a greater risk of missing another medical condition than you do of getting COVID.